Welcome to the deep dive. Today we're looking into something pretty important if you have pets' oral ulceration in dogs and cats.
Yeah, those painful mouth sores.
Exactly. We're using a veterinary guide to really unpack what they are, the causes, potential treatments, basically stuff that can help you spot issues in your own pets.
And it's quite a range of causes, isn't it? It's
Yeah.
not always straightforward.
Not at all. I mean, it goes from dental stuff right through to potentially quite serious systemic diseases. So let's maybe start with the basics. What exactly is oral ulceration?
Right. So fundamentally, oral mucosal ulceration just means there's a loss of that top surface layer, the epithelium, inside the mouth. It's like a break in the lining.
Okay, like a sore or a raw spot.
Precisely. And, it very often happens alongside inflammation in the mouth and throat area or pharyngeal inflammation.
Ah, so they often come together.
They do. And vets actually classify that inflammation based on exactly where it is, which helps pinpoint things.
Okay, let's break this down. I think most people know gingivitis, gum inflammation.
That's the one. And periodontitis is related but deeper, affecting the structures holding the teeth in place.
Got it. What else?
Well, you can have alveolar mucositis. That's inflammation on the gum over the jawbone. Sublingual mucositis is under the tongue, on the floor of the mouth.
Okay.
Then there's labial or buccal mucositis. That's the inside of the lips and cheeks.
Inner lips and cheeks, right?
And caudal mucositis is specifically the inflammation way at the back of the mouth.
How far back are we talking?
Think of the area bordered by those folds at the side back there, the palate above, and the sort of inner cheeks and gums more towards the front. That whole zone.
Okay, that helps visualize it, and the list keeps going, I see.
It does, yeah. Colitis is the roof of the mouth. Glossitis involves the tongue.
Tongue inflammation, okay.
Hylitis is inflammation of the lips themselves. And osteomyelitis is that's inflammation actually in the bone.
Bone inflammation, wow. And what about stomatitis? I feel like I hear that term a lot.
You do. It's often used clinically as a more general term when the inflammation isn't just, say, the gums, but it's really widespread throughout the mouth. Sometimes quite deep, too.
So it's sort of an all-encompassing mouth inflammation.
Kind of, yeah. And then, of course, you've got tonsillitis and pharyngitis tonsils and the pharynx, the throat area.
Right, so this isn't just a dog thing or just a cat thing. Both can get these ulcers.
Both, definitely. Dogs and cats. But what's interesting is we do see some breed tendencies pop up.
Oh, like what?
Well, for canine ulcerative stomatitis, that specific type in dogs, it seems to show up more often in breeds like Maltese, Cavalier King Charles Spaniels, Cocker Spaniels, Bouvier de Flandre.
Good to know if you have one of those breeds. Any predispositions in cats?
Yes, there seems to be a potential link, maybe a predilection, for feline stomatitis, sometimes called LPS in Somali and Abyssinian cats,
Okay.
and also idiopathic osteomyelitis, that bone inflammation with no known cause, seems maybe more common in Cocker Spaniels, and it sometimes links up with the canine ulcerative stomatitis too.
So some definite breed connections to be aware of. What about age or sex? Does that make a difference?
The guide we're looking at doesn't actually point to a specific mean age or range, or whether males or females are more affected overall. Seems like it can happen to any dog or cat, really.
Okay, so it's widespread, but good to keep those breeds in mind. Now, for someone listening, what are the actual signs? What might you see that makes you think, maybe something's wrong in there?
Yeah, good question. Halitosis, just bad breath, is a big one.
Yeah.
Really common.
Okay, bad breath.
You might see the obvious redness and swelling of the gums, the gingivitis, maybe signs of a sore throat, difficulty swallowing that points towards pharyngitis,
Makes sense.
inflammation inside the cheeks, bursitis, or actually seeing sores there. And tylism is another sign.
Tylism. What's that?
It's excessive drooling, but it's often described as being quite thick saliva, almost ropey sometimes.
Thick, ropey drool. Noted.
And, of course, pain. That's key. They might be reluctant to eat off their food.
Anorexia, right?
Exactly. Or just clearly uncomfortable when eating. And then you might actually see the ulcers. With ulcerative stomatitis in dogs, they talk about contact ulcers or kissing ulcers
Kissing ulcers. Why that name?
because they literally form where inflamed surfaces touch or rub against each other, like the inflamed gum rubbing against the inside of the lip.
Oof, that sounds painful. What else might we notice?
You might see more plaque buildup, maybe with calculus or tartar. In more severe things like osteomyelitis, you might even see exposed bone that looks unhealthy, necrotic.
Exposed bone. Yikes.
Yeah. And changes in behavior, too. Maybe they're more irritable, less willing to play with toys because their mouth hurts.
That makes sense. Less interested in chew toys.
Right. And specifically with canine ulcerative stomatitis, you can sometimes see scar tissue forming along the sides of the tongue.
Scarring on the tongue. Wow. It all sounds really unpleasant for them.
It really does.
Now, I saw a note that sometimes signs appear or get worse after a dental cleaning. That seems weird. Why would cleaning make it worse?
That's a really good point. And it does seem counterintuitive, doesn't it?
Yeah.
But the thinking is that the cleaning process itself, the scaling, the manipulation, might temporarily irritate tissues that were already inflamed or borderline.
Ah, so it stirs things up.
Exactly.
Yeah.
It doesn't cause the underlying problem, but removing the plaque and calculus might suddenly make a pre-existing, maybe low-grade inflammation much more obvious.
Okay, that distinction is important. It unmasks it rather than causes it.
Precisely.
Right, let's dig into the causes then. This guide breaks them down, which is helpful. Where do we start? Metabolic issues.
Yep, metabolic is a big category, things affecting the whole body's chemistry. So diabetes, mellitus, hypothyroidism, and kidney disease are major ones.
Kidney disease. How does that cause mouth ulcers?
Through uremia. When the kidneys aren't filtering waste properly, toxins build up in the blood, and that uremic state can directly damage the oral tissues and lead to ulcers.
Wow. So a mouth ulcer could actually be a sign of kidney failure.
It certainly can be. It really shows how oral health can reflect overall systemic health.
That's a critical point. What else? Nutrition.
Yes, there usually needs to be quite severe. Things like significant protein-calorie malnutrition or a deficiency in riboflavin, which is a B vitamin.
Okay. And unfortunately, cancer is on the list too.
It is neoplasia. In dogs, you worry about things like malignant melanoma, squamous cell carcinoma, fibrosarcoma. Even benign tumors can ulcerate.
And cats. Similar offenders.
Similar, yeah. Squamous cell carcinoma is a big one in cats, fibrosarcoma too, and malignant melanoma, though maybe less common than in dogs.
Always something serious to keep in mind. What about when the immune system itself causes problems?
Right, the immune-mediated diseases. This is a really significant group. Conditions like pemphigus vulgaris and bullous pemphigoid often have oral signs, like a high percentage of cases.
So the mouth is commonly affected in those.
Very commonly. Systemic lupus erythematosus, SLE, can also involve the mouth, maybe moderately. Discoid lupus too. And then there are drug reactions.
Drugs can trigger it.
Yes. Severe reactions like toxic epidermal necrolysis or erythema multiforme can definitely cause oral lesions. And immune-mediated vasculitis, where the blood vessels are attacked. It's basically the immune system getting confused and targeting the mouth's tissues.
Fascinating and a bit scary. Okay, what about infections? Bugs and viruses?
Absolutely. Infections are a major player. In cats, you think about retroviruses, FLV, FIV.
Leukemia and immunodeficiency virus.
Exactly. Also, calicivirus and herpes virus are common culprits for oral ulcers in cats.
And dogs.
Leptospirosis, a bacterial infection, can cause oral signs in dogs. And then periodontal disease itself.
Gum disease.
Yes, in both dogs and cats. That chronic bacterial infection is a huge cause of inflammation and can certainly lead to ulceration. It really circles back to basic dental hygiene again, doesn't it?
It really does. Okay, besides disease and infection, can physical things cause ulcers?
Trauma.
Definitely. Trauma is another category. It could be a foreign body, like they chewed on a stick, or a bone fragment gets lodged.
Electric cord shock is sadly common, especially in younger animals. Malocclusion, where the teeth don't line up right and cause constant rubbing or biting.
Bad bite, yeah.
And even something called gum chewer's disease, which is basically chronic cheek chewing.
Chewing their own cheeks. Poor things. Any chemical or toxic causes.
Yes. If they ingest something caustic, like certain cleaners, that can cause severe burns and ulcers. Or exposure to toxins like thallium.
Right. And then there's the mystery category, idiopathic.
Exactly. Idiopathic meaning we just don't know the specific cause, and that can be really frustrating for everyone involved.
I bet. What falls into that category?
Well, in cats, there's the eosinophilic or granuloma complex, and the big one, feline stomatitis complex. Really challenging condition.
Feline stomatitis, yeah. Hear a lot about that. Dogs.
In dogs, there's ulcerative stomatitis, which we think might be an allergic or hypersensitivity reaction to their own dental plaque.
A reaction to plaque itself.
That's the theory.
Yeah.
And idiopathic osteomyelitis, that bone inflammation we mentioned earlier, without a clear trigger.
So With this huge list of possibilities, how does a vet actually figure out what's going on? What's the diagnostic process look like?
It really starts with a good history from you, the owner. When did it start? What do they eat? Any other signs?
The background story.
Exactly. Then a really careful look inside the mouth. Sometimes you find the smoking gun right away, the foreign object, the misaligned tooth, signs of a burn.
So the exam is key.
Crucial. And especially for those idiopathic conditions, the pattern of the lesions, the breed, how they respond or don't respond to initial treatments, it all adds clues.
Putting the puzzle together. I assume lab tests come next. Blood work.
Definitely. A CBC, biochemistry profile, urinalysis, those are vital for checking for those underlying metabolic problems, like diabetes or kidney issues.
Checking the body's chemistry.
Right. And they can show signs of infection, like changes in white blood cells or chronic inflammation, maybe with high protein levels. Sometimes thyroid tests, T4 levels are needed too.
Especially if hypothyroidism is suspected.
Or just because chronic inflammation can sometimes affect thyroid levels. And in cats, testing for FeLV and FIV is pretty standard.
Makes sense. What about culturing the mouth? Does that help find specific bacteria?
It's often done, but honestly, interpreting oral cultures is tricky. The mouth is full of bacteria normally.
So it's hard to tell the good guys from the bad guys.
Pretty much. It's hard to know if what grows is truly causing the problem or just part of the normal oral flora that's overgrown because the environment is inflamed.
Okay. And what about looking deeper? X-rays.
Imaging, yes. Radiographs are really important if we suspect the bone is involved, like with that idiopathic osteomyelitis. You need to see if there's bone loss or changes you just can't see by looking.
See what's happening underneath the gums.
Exactly. But often, for a definitive diagnosis, especially if you suspect cancer or an immune issue, a biopsy is the gold standard.
Taking a small tissue sample.
Yes, biopsy and cytology, looking at the cells. That's often how you diagnose neoplasia or confirm immune-mediated disease. For feline stomatitis or canine ulcerative stomatitis, the biopsy often shows lots of specific immune cells, lymphocytes, and plasmacytes.
Ah, confirming that inflammatory reaction.
Right. Though sometimes the pathology report just comes back as non-specific inflammation, meaning the tissue is damaged and inflamed, but it doesn't point to one single cause.
So it's really a combination of history, exam, labs, imaging, and sometimes biopsy to get the full picture.
That's the process. It's detective work.
Okay, so once you have a diagnosis, or at least a strong suspicion, what does treatment look like? How do we help these pets feel better?
Treatment is often multi-pronged. Supportive care is huge. Maybe switching to a soft food that's easier to eat.
Makes sense if their mouth hurts.
Fluids if they're dehydrated. Sometimes hospitalization if they're really unwell. And pain management is absolutely critical.
What kind of pain relief?
It can range from topical gels applied in the mouth to oral pain meds, sometimes even things like gabapentin or other drugs that target nerve pain. It really is. And that's why client education is so important. Vets need to explain the prognosis can be guarded. It depends on the cause, and it might involve long-term management, maybe more extractions later.
Managing expectations.
Exactly. For those chronic conditions like canine and feline stomatitis, we encourage owners to do any level of home care they can manage, but always gently, remembering how sore these mouths are.
Gently, right. Now, you mentioned extractions. Is surgery often part of the plan?
Yes, surgery can be key. For those chronic idiopathic problems, strategic extractions, sometimes just the back teeth, sometimes partial mouth, sometimes full mouth, can remove the main trigger for the inflammation, which is often the plaque on the teeth.
Removing the source of the problem.
That's the goal. Especially in cats with stomatitis, it's vital to remove all tooth structure, even root fragments. For osteomyelitis, surgery might mean removing dead bone, closing the gums, and using antibiotics, but you have to monitor closely for recurrence.
Okay. Let's talk medications. What are the main drug types used? Antibiotics.
Antimicrobials, yeah. They're used a lot, both for primary infections and to control the secondary bacteria that inevitably jump in when tissue is damaged. Things like clindamycin, amoxicillin clavulinate, tetracycline are common.
Are they used long-term?
Sometimes pulsed between cleanings to keep inflammation down, but there's always the concern about antibiotic resistance with chronic use. It's a balance.
Right. What about anti-inflammatories? Steroids?
Corticosteroids like prednisone are definitely used to reduce inflammation and make the pet more comfortable. But again, it's a balancing act. You want relief, but you have to watch out for the long-term side effects of steroids.
Always a trade-off with steroids. Anything else?
Mucosal protectants can be helpful, especially for chemical insults, things like sucralfate or maybe cimetidine.
Like coating the sores?
Kinda, yeah, protecting the lining.
Hmm.
And after extractions, good analgesics pain relievers are essential. Carprofen, maybe opioids like hydrocodone or tramadol for a short period.
Okay. And topical treatments, things you put right in the mouth.
Yes, chlorhexidine rinses or gels are common antiseptics. Some products with zinc and vitamin C, ascorbic acid, are sometimes recommended to potentially help healing.
Are there meds that should not be used? Contraindications?
Well, obviously known hypersensitivities, and a big one is not using corticosteroids if there's a systemic fungal infection.
Right. Steroids suppress the immune system.
Exactly. And you'd be cautious with steroids in any immunocompromised animal, like one with the FIV or FLV. Also, some antibiotics can cause stomach upset.
Good precautions to know. Does the guide mention drug interactions or alternative therapies?
No, this particular source doesn't specifically call out drug interactions or list alternative options. Focuses on the conventional approaches.
Okay, so careful monitoring and follow-up are needed then.
Absolutely.
Yeah.
Regular recheck exams are essential to see how things are progressing, adjust treatment, catch flare-ups early, and reinforcing that home care, the plaque control, is key for long-term success.
Prevention is better than cure, as they say.
Especially with plaque-related issues, yes.
Are there specific complications to watch out for, beyond side effects or recurrence?
The guide doesn't list specific complications beyond those we've touched on, the potential for recurrence, side effects, the challenges of managing chronic pain.
Right. So finally, what's the general outlook? What can people expect?
It really depends on the underlying cause. That's the main message. Some things resolve well, others require lifelong management.
And maybe more extractions?
Potentially, yes. It's also worth knowing that even after extractions, the inflammation can take a while to fully settle, maybe 4 to 6 weeks, just because of the healing process, and the tongue can hold on to plaque too.
So patience is needed after surgery.
Definitely. And for feline stomatitis, the outcomes with extractions vary. Studies suggest maybe 60% get significantly better, another 25% see some improvement, but unfortunately around 15% are considered refractory, meaning they don't respond well even to full mouth extractions.
So not always a magic bullet, but helpful for many.
Exactly. It's often the best option we have for those severe cases.
Okay, this has been incredibly informative. I think the big takeaway here is just how complex oral ulceration can be in our pets. It's not just one thing, it has this huge range of causes.
Absolutely.
And getting that accurate diagnosis is so critical, involving potentially more than just a quick peek in the mouth. It really drives home how important it is for us as owners to be vigilant about our pets' mouths and get veterinary help if we see anything worrying.
Couldn't agree more. And, when you stop and think about the mouth, it's such a complex environment, isn't it? This whole ecosystem of bacteria.
The oral microbiome.
Right. And so many factors, systemic health, local irritation, immune responses can disrupt that balance and lead straight to inflammation and these painful ulcers.
It really highlights that connection between what's happening in the mouth and the pet's overall health. Maybe something we don't always think about enough.
It's a connection worth remembering, definitely. Something to consider how interconnected oral health and general well-being truly are in our animal companions.